Digestive disorders. Here we go. Look at that guy there. I'll bet you felt like that at least once in your life. Most people have. So we're going to just kind of take a survey through some of the main digestive disorders, all right? Starting with oral cancer, we're basically going to follow our way through the gastrointestinal tract and hit the accessory organs along the way. Oral cancer usually involves tissues of the lips and tongue, cheeks and gums. And often painless is one of the things. Here, those of you who are going to be dental hygienists, here's a huge part of your job. You need to examine people's mouths and look for oral cancer, and if you see it, you need to let them know because they might not find out on their own. And given that maybe people come in only every 6 months or whatever to see you, if you don't tell them by the next time, it might be too late. So, important job for you guys. They're mainly squamous cell carcinomas, like you see in the integumentary system. They metastasize rapidly, which means once they happen, chances for recovery are not very good. Tobacco and alcohol, main ones, and especially the number one cause, by far, chewing tobacco. Absolutely. Just a pinch between your cheek and gum. I was in Oklahoma for a few years. I taught at a little liberal arts teaching college there. And different culture back there, but chewing tobacco was very common. And kids started using it as early as like 11. And you had kids with oral cancer by the age of 18, 17, 18. 4 or 5 years of putting that stuff right into your mucous membranes on a regular basis. I mean, it's pretty much, if you wanted to get oral cancer, there's no faster way than using chewing tobacco, which they have various names for, dip, snuff, chaw, but it's just a really bad idea. Asian cultures, they also have the beta leaf and the areca nut. So, it's a worldwide thing. People like to put something in their mouth that they can kind of chew on that gives them a little bit of a buzz. But the problem is, with all the mucous membranes in your mouth, God, if there are any carcinogens in what you're putting in there, that's the fastest way to get cancer, no doubt about it. Easily detected with simple oral exam by a dentist, physician, and treatment is usually easy as long as you catch it early on. So for God's sakes, Red Man, Skoll, Copenhagen, you guys just don't do this. All right, GERD, gastroesophageal reflux disease, also known as acid reflux. So what's going on? Well, think about it. We already know the esophagus leads to the stomach. The stomach, of course, makes powerful acid, hydrochloric acid. And what can happen here is that the symptoms are heartburn, indigestion, regurgitation, trouble swallowing, dysphagia. It's the lower esophageal sphincter. All right, that's what closes off. There you see in the upper illustration. Normally that closes off the esophagus from the stomach. So when you swallow, remember peristalsis moves it down. And then the LES is a smooth muscle, so it's under autonomic control. It will automatically open up to allow the bolus of food into the stomach. Well, sometimes for whatever reasons it doesn't close, and then stomach acid literally splashes back up into the esophagus. And this is a bad deal, okay? Certain foods seem to aggravate this. Coffee, alcohol, acidic fruits, peppermint, chocolate, carbonated drinks, large meals. Basically any large meal, of course, you're going to have lots of stomach acid, and so there's a better chance for it to splash around. So you can use antacids, proton pump inhibitors, or eventually surgery, if that's what it comes down to. Now, what's the difference between an antacid and a proton pump inhibitor? So antacids are just bicarbonate ion, and what they do is you take those once you have GERD. The proton pump inhibitors, which they're very common on the market now, and I'm at the moment forgetting all the names for them. Is Tagamet one of them? I don't remember. But what you do is you take them before you eat, and they inhibit proton pump. What does that mean? Protons, hydrogen. They basically inhibit the formation of hydrochloric acid. Now, of course, that means you should probably take it easy when you're eating because your stomach's not going to be making as much acid. But from the standpoint of GERD, that could be helpful. And ways to treat it, good posture. For one thing, if you lie down after a big meal, what you're doing is you're allowing all the stomach acid, due to gravity, it's going to flow back towards your LES. So after eating a meal, you should stay relatively upright, sitting or standing, to help gravity, keep that stuff down in your stomach. Keep the head elevated while lying down, and avoiding meals just before you sleep, all right? You shouldn't eat for at least, an hour or a couple hours before you go to sleep. You're just tempting fate. And there you see in the lower right, that's what it looks like. You're seeing an endoscope there showing when that stomach acid splashes up there. Look at that irritation. Oh my God, that's not comfortable. So be careful. Hernias. So there are lots of hernias, more than you probably thought there were. So let's take a look at the various kinds of abdominal hernias. Hernia, by the way, can refer to a variety of things. So it's best to say abdominal hernia, all right, to make clear that we're talking about these. So this is a weakness in the abdominal wall that allows adipose or an organ to protrude. So basically you can see there in the lower right, there is the most common kind of hernia, inguinal hernia. You see there basically a loop of the small intestine poking through the opening. And we'll see why just in a moment, why that's so common. So many types, again, inguinal hernia, which we were just talking about. What happens is, as we'll see when we get to these, the reproductive system, and you can see on the right-hand side of that lower illustration, the spermatic cord in males has to come through the abdominal wall. Initially, remember, females, the ovaries are inside the abdomen. Well, they start that way in males as well, but then the testes descend. And when they descend, of course, there has to be an opening for them to get through the abdominal wall. And that's the inguinal canal there. And so what happens is males have a predisposed weakness where that spermatic cord came through. And that's where, over time, with the various, with weight gain and things like that, that abdomen can start really pushing on that opening, and eventually little bits of the intestine can poke through. Hiatal hernia, different. That's where the stomach protrudes above the diaphragm through the LES. So notice that's the one on the top. See, the LES, the esophagus has to connect to the stomach, and there's a little opening there in the diaphragm. Well, what can happen is a bit of the stomach can push its way back up through that opening, and that's a hiatal hernia. I saw a guy who had one. It looked like he had a doorknob, right at the bottom of the sternum. Looked like a doorknob there, and that was just part of the stomach poking through. Epigastric, protrusion through the linea alba. Remember the linea alba, that big connective tissue line that goes down the middle of your abdomen, above the umbilicus. And then paraumbilical is a protrusion around the umbilicus. So they're all basically the same thing. In every case, you've just got something protruding through the abdominal wall, or in the case of hiatal, through the diaphragm there. So hernias can easily be treated by surgery. They often will put in a mesh to keep the protrusion from recurring. And they sell all these weird things, hernia belts and trusses and weird things like that. Those normally don't do much good. They're not very helpful. Hernia is usually not a big deal, and a lot of people just live with them. They're not necessarily very serious. Again, they're very common, but you can get them easily treated by surgery. They now have a robot that does it. You don't even have to have a person doing it. The robot can do your hernia surgery, just like they have when removal of the uterus, a hysterectomy. They got robots now that do those surgeries. Okay, gastritis. Look at the word gastro, gastric. Remember, that always means stomach. Itis means inflammation. So gastritis, inflammation of the stomach. It's that simple. The lining of the stomach, many, many causes. So one of the most common, Helicobacter pylori, H. pylori, a bacterium, all right, that gets down there and causes irritation. Warren and Marshall got the Nobel Prize in 2005 for doing this. This was actually, this is also the cause of ulcers, and they got the Nobel Prize. Pretty cool. One of them, I don't remember which one, actually gave himself an ulcer with the bacteria and then cured it with an antibiotic, because nobody believed him. They thought, no, they're caused by stress. He actually intentionally gave himself an ulcer and then cured himself with antibiotics. And yeah, Nobel Prize material right there. Also, alcohol. Alcohol, it burns. Put it in your mouth. Notice how it burns. Yeah, well, it's going to burn your stomach too. So heavy alcohol users often have gastritis. Non-steroidal anti-inflammatory drugs, aspirin, ibuprofen, naproxen, those really eat away at that lining. Bile reflux, all right, can happen. Frequent vomiting, people with eating disorders, vomiting all the time. Pernicious anemia, remember the inability to absorb vitamin B12 because of the lack of intrinsic factor. That can cause irritation. Viruses can do this. And, just, of course, spicy foods, a lot of Italian foods, a lot of very acidic foods, tomatoes, all that red tomato sauce, that gives a lot of people gastritis. So, some of these are easily curable. Just, stop drinking alcohol, stop eating, red sauce, get your eating disorder under control and so on. So, and of course, many symptoms and vomiting if the stomach is irritated, pain, you get a nausea, of course, indigestion, loss of appetite. It's just, it kind of all makes sense. And there you see in the lower illustration, there is a stomach with gastritis. There's a rugae, remember, those little ridges. And look at how irritated they are. That's classic gastritis. What do? You treat it with antacids, antibiotics, changing your diet. Depends on the cause. But generally speaking, there's something you can do. And a lot of it really is changing your lifestyle. You just have to make some changes. Right? Now, there you see a picture of my chair there, my bottle of tequila. I actually wrote the chair manufacturers, told them they need to make the tequila bottle holder a little deeper. It's not very stable when it's that way. There's me at a place called The Maze in southern Utah. Incredible. Totally by myself there in the middle of damn nowhere. But I injured my back when I was in my 30s, and I have a herniated disc, and I get regular pain in my lower back. And at one point, a doctor prescribed me heavy-duty naproxen, 500 milligram naproxens. He said, take 2 of these a day, and that should help with your back pain. And I said, knowing that naproxen is an NSAID, I said, so do I just keep taking these until I start basically coughing up blood? And he said, yeah, basically that's what it comes down to. So I noticed then as I was taking the naproxen, it was helping my back, but I'm a huge tequila fan. And I noticed I started getting gastritis from the tequila, so I had to make a lifestyle change. I either had to stop taking those naproxens or I had to stop drinking the tequila. And that was an easy decision, of course. I stopped taking the naproxen. I now live with lower back pain, but I still get to drink tequila. Guaraleo, one of my favorite. Okay, peptic ulcer disease, PUD. Ulcers in the GI tract, okay? Very painful. These really, you get people doubled over in pain from ulcers. 80% associated with that bacterium, Helicobacter pylori. That's what those guys got the Nobel Prize for. Most actually occur in the duodenum, not in the stomach. And remember, think about it. You've got that very acidic chyme from the stomach getting dumped in the duodenum. The duodenum tries to protect itself by secreting bicarb, but that's often the place where you do a lot of damage. All right, because dang, that acid getting down in there can overwhelm your body's ability to neutralize it with the bicarb. So most of them, some occur in the stomach, but apparently most occur in the duodenum. Symptoms include pain, nausea, loss of appetite, duh. Also caused by NSAIDs. That was basically, the other thing I had to deal with there with my back pain. And foods high in flavonoids may inhibit the growth of H. pylori, so there's, a natural cure. Those include things like fruits, berries, parsley, onions, garlic, dark chocolate, green and black tea. Boy, if you ever wanted an excuse to have those foods, now you got it. See what a great job I'm doing to help you out in life. There you go. Okay. So pancreatitis, obviously, again, inflammation of the pancreas. Acute, that's the most common causes are gallstones and heavy alcohol use. So notice, in the upper illustration there, you got the common bile duct and the major pancreatic duct. They come together at the hepatopancreatic ampulla. People who have gallstones, the gallstones may come down the common bile duct and then get stuck there in the ampulla. And that can prevent the release of pancreatic enzymes. What happens? The pancreatic enzymes start to back up into the pancreas, and then you basically start to digest your own pancreas. So that's acute pancreatitis. Severe pain, vomiting, tender abdomen, fever, distended abdomen. Yeah, that's really unpleasant. It can resolve spontaneously if you can clear the gallstone out of there, okay? So, and also, cutting down on the alcohol use and so on. Chronic is a little bit different story. This is where the digestive enzymes are regularly getting backed up into the pancreas, and this often happens after years of heavy alcohol use or after lots of extended gallbladder problems. So immune disorders, hyperlipidemia, too much fat in the blood, hypercalcemia, too much calcium, that has to do with the gallstones themselves. Cystic fibrosis, this is a symptom with that. Symptoms include nausea, vomiting, diarrhea, pain, just very digestive kind of related things. Your pancreas is unhappy. It's an accessory organ of your digestive system, so you end up with various digestive problems. And the problem here is that if you start digesting your own pancreas, you start digesting those pancreatic beta cells, you can lose your ability to produce insulin, and therefore long term it could lead to diabetes. So pancreatitis is kind of a serious thing, all right? Treat it with a change in diet, maybe some synthetic enzymes, okay? So, and pancreatic cancer, this is usually not a happy diagnosis. Malignant tumor of the pancreas spreads rapidly, seldom detected in the early stages. That's the problem. So by the time they find out you've got it, it's usually too late to do much about it. So it has a very poor prognosis usually. A very old friend of mine, I've known her since the 1970s. She just got a diagnosis of pancreatic cancer. And they basically just told her, that there's nothing they can do. They're just going to keep her on pain meds until she dies. So, very sad, but what happens. She's my age. She's like 70. So it's the way life works. Symptoms include upper abdominal pain, jaundice, loss of appetite. So not surprising here. May not occur until the advanced stages. Risk factors, smoking. Smoking is a risk factor for everything that's bad, really. Obesity, family history, chronic pancreatitis. So again, if you got regular pancreatitis again and again and again, those heavy alcohol users, they often end up with pancreatic cancer. And surgery doesn't really do any good. And there you see the guy from Ghost, Patrick Swayze from Dirty Dancing. That's what killed him. So gallstones, cholelithiasis, all right, chole, root word for gallbladder, lith, root word for stone, literally gallbladder stones. So made of cholesterol and or bilirubin, or some combination of the two. Range in size from grains of sand to golf balls. There, look at that lower illustration. Damn! May occur singly or in numbers as many as hundreds. So you look at the upper illustration there on the left. Sometimes they go in to do the surgery, and the person's gallbladder is just full of them. Full of them. They can block the cystic or bile ducts, leading to pancreatitis. That's what I mentioned before. They can get loose. They come down the cystic duct, get into the common bile duct, get down to the hepatopancreatic ampulla, block the release of pancreatic enzymes, therefore they back up into the pancreas, and the next thing you know, you got pancreatitis. Risk factors, sex. Women seem to get this more often than men. Obesity, family history, diet, age, diabetes, lots of risk factors. Again, diet makes such a big impact on so many of these things. Having a reasonable diet, high in fiber, low in processed foods and sugar, that really does make sense. It really does improve your health in many, many ways. Can be treated with drugs to dissolve, but recurrence is high, so oftentimes they just go in and cut that thing out. And that's a cholecystectomy, all right? Technical term. One semester I had a woman bring her gallstone in, and it was the size of a ping pong ball. She had it in a little plastic, like a plastic, pill dispenser. She had it in one of those so we could look at it, pass it around. I said, damn, that's obvious. I said, can I have this? She said, no. I didn't expect her to, but damn, it was impressive to see a gallstone the size of a ping pong ball. What is it, gallbladder? Can't you see I have a lot to do? I make these. You made stones? You're just supposed to hold what I give you. Get out, go on. I make these. Oh, the poor little gallbladder. Feeling so upset.